It is now time for our panel discussion, The Employer's Role in Driving Innovation and Better Health. Please welcome Christophe Weber, President and CEO of Takeda Pharmaceutical, Leah Binder, CEO of the Leapfrog Group, and Aneesh Chopra, Chief Strategy Officer at Arcadia. A quick note from our editorial staff. Though Takeda is the sponsor of today's event, we felt they were an important voice to include in the editorial portion of today's programming. Welcome all.
Well, good morning, everyone. Thanks so much for joining me for the panel discussion following the two lawmakers. I want to start out with a broad question to all three. Christophe, we can start with you. Employers cover more than 150 million Americans. From your vantage point, what is the single biggest lever employees have to improve value and outcome in healthcare?
Well, first, there is employers have been relatively passive until now when managing the health benefits of their employees. But when ourselves, but also when I speak with my colleagues, everybody is now struggling with the growth of the cost. It's in double-digit territory for the majority of the companies. And therefore, it's becoming a significant issue, which is how can we improve the outcome of this investment? I don't think we will see healthcare costs decreasing. I think our goal should be to reduce the growth. And if we could move from a double digit to a mid-single digit, it would be quite already a huge achievement. But I think it's coming from there. And we know that the healthier our colleagues are, the better for the company, right? There is no doubt about that. So I think you will see more and more employers being much more active and innovative in the way to manage our health benefits. And more broadly, I think that the healthcare system could be transformed by the employers. It's much more difficult when you are a government to transform healthcare. I think it can be much more dynamic from an employer if the employer are catalyzing that evolution and making healthcare systems more performant and more innovative.
Right. Leah, I would love to get your take on that.
Well, I completely agree that we're seeing major change in the approach that employers have toward health benefits. I'm seeing a real shift. The health costs are going up again, and I say again because it's been, we had a relative period of some, not decline, but some lesser growth, especially around COVID, but now they're soaring back up, and employers are alarmed by it. There's a great study by a business group on health. They do it annually to look at health costs, and they found that employers are predicting 9% increases in 2026, and if they take no steps to reduce their benefits, which they're going to do, so then if they do that, they're figuring it'll go up about 6.7%. So those are both alarming numbers. 6.7% compounded annually means that employers are headed in a direction that is absolutely unsustainable. Traditionally, the approach to cutting costs would be pass more costs off onto the employees. And certainly they're going to have to do that. That is part of the strategy, higher deductibles, co-pays, et cetera. But the other thing we're seeing that I'm really excited about is an approach to improve the quality of care. The value of care, the right price for the right care, and improve transparency so people are getting better care. And that is a very exciting approach because that will, in fact, lower costs over time. But it also improves the experience and the outcomes for all of us. It improves healthcare in general because it drives change.
And Aneesh,
yeah, I'm going to place this more as a gauntlet than an answer, and that is it's the employer's opportunity to step up to the moment we're in right now to make a meaningful difference. And maybe I'll say three things to give you a little bit of context. One, let's state the obvious. In any given healthcare market, the employers individually are a minuscule fraction of a provider panel. So there's not a lot of scale for any single employer to make a difference. But when you aggregate, there's an opportunity to have a lot more influence. So point one is fragmentation's been a challenge. However, point number two, going back to the National Business Group on Health survey, the same survey that said there's a 9% inflation also said 90% or 89% of employers said their top priority this year is to help consumers navigate to the highest quality providers in the network. Why is that relevant? Because what we're seeing at the moment is that providers that have embraced some of the CMS or government-oriented programs to coordinate care, to establish bundles, are delivering differentiated quality at lower cost. Just employers don't play in that economic model, so there hasn't been a connection. So in this dynamic, there's a window of opportunity to kind of bridge what's happened on the CMS value-based care world and the employer world through navigation and routing. But here's the gauntlet, here's the opportunity. Not more than 3 weeks ago, President Trump hosted Apple, Google, all the major health tech companies, Epic, Cerner, all the major health CEO of the Cleveland Clinic. Everybody came to Washington to say, we will purposefully unleash a health tech ecosystem with 3 main objectives. Give every American the ability to have a conversational AI agent on top of their actual medical records, so we don't have to scan our lab results and ask ChatGPT, is our health okay? Number 2, they said we want to have a mechanism by which individuals can have some form of, let's call it digital check-in or QR code, so we can kill the clipboard. So imagine an employee walking in and you just sort of scan like we do at the airport, our boarding pass, we scan, and all of our medical records transfer in pre-populate forms. And then 3, in the area of prevention, for diabetes in particular, they said, let's work on ways in which we can give people virtual coaching. Not a single employer showed up at the White House.
Wow.
That's an opportunity. If we bring employers into the health tech ecosystem, at this moment, we can awaken, I think, the most important voice to drive change in conjunction with, but not at the same pace of the government. So it's not going to be government programming. It'll be building on the rails. In my opinion, I think it's an opportunity that we're going to see in the next 12 months.
And I'm curious why aren't we seeing in those conversations? For example, you mentioned there was an employer at the White House.
4 years ago, and I'll get back to the 2 of them, 4 years ago, CMS mandated the first regulation on health plans to make data available to the individual. And the government could only mandate those rules on government-sponsored plans, ACA, Medicare Advantage, Medicaid. At the time, I was begging employer groups to join, because if you're doing IT work as a health plan, you do it across all lines of business, but the government mandated it only on, the government book. So literally, business leaders at the plans were saying, Aneesh, if I get a demand signal from the employers, I'm in. Nada. So they shipped the technology to do all this interoperability, but only for government book. Then the governor of California, Gavin Newsom, said, I'll do it. So literally, go to the Cigna webpage. We'll give the data to government patients of Cigna, ACA, but only commercial employers living in California because the governor signed a law. That's ridiculous. So today, we can have the digital QR code and these conversational AI for government patients, Medicaid, ACA, but not employees.
Right. Christophe, back to you. In your role and work with Takeda, what are the current challenges you see as an employer with a large employee base in the U.S.?
Well, I think there is no question we will be more active, helping our employees to be more informed about what are the options to better manage the health services. I think there are 2 issues that I think are really something that we should fix in the US. One is price transparency, cost transparency, and outcome transparency. And this is a major issue to a scale that is relatively unknown, actually. So you take medicines used by hospitals, the price can vary from 1 to 7 folds in the same city. And we have exactly that example at Takeda with one of our medicines is used by hospitals, is charged to the patient and to the health insurance. The price vary by 1 to 7 fold, completely opaque. Within the same hospitals, the price charged to the patient can vary 1 to 7 fold as well, depending on what the hospital's price can be negotiated with the insurers. I think we need transparency on that, so that, because if you want to provide a choice, you need to be able to provide transparency about the cost as well as the outcome. It's a major issue. The second issue that we are having is that if we want to move into more predictive healthcare, preventive, we don't have enough data. And our employees don't have enough data. And so, and I think this is something we need to crack, is how much data do we have access to in order to provide proper advice to our employees. We don't have genotype data, we don't have prevention data, we don't have health status data. And so we have consumption data today. And that's a major issue to move into predictive healthcare.
All right, Leah, I want to go to you on this issue of quality. Employers rely on hospital and health plans, but they often don't have as much insight into quality. How can they push for those higher standards so patients can get the highest quality possible?
Well, they are pushing for transparency. So that is a very good point about transparency. Though they're pushing right now for price transparency. That's been a major priority for many of the employers we work with, certainly, and I know for many of the organizations like the ERISA Industry Committee, like Business Group on Health, have all been pushing forward legislation around price transparency, and there is something in the House right now that the price tag for patients legislation that is really exciting, that would provide for much higher levels of transparency on pricing for consumers as well as for employers. But price transparency is not enough, and they recognize that. It has to be combined with quality transparency. Here's the fundamental reason. There is no good price for bad care. If you're going to get a bad care, you don't care how much it is. How much is an infection worth to you? If you know, it's not worth anything. That you don't want to argue about that price. You want good price for good care. And so getting at that issue of good care has been a really major priority for employers for literally 25 years. And they have been pushing for it. My organization, Leapfrog Group, is just an example of that, which was started for the express purpose of publicly reporting by facility on how good the quality of care is and how safe it is. That's what employers need to have now, and that's what they're pushing for in a variety of sectors, but they're also just trying to go out and get the data themselves. So I think that is what's, here's why I think that's new, there's something new about it in the current environment. Traditionally, the debate around healthcare has always centered on health plans and third-party payers, Medicaid, Medicare, how are they doing? And we say, well, if you have good access to care, that means you have health insurance. But health insurance is just a laminated card, or nowadays something on your phone probably. Health insurance isn't care. We have to look under that and say, well, what exactly is happening when someone goes into the hospital? And what happens to them there? Are they getting good care there? Because the truth is, errors and accidents, injuries and infections in hospitals are the third leading cause of death in this country. And we just never get to that conversation because we're so busy talking about health plans. We have to get under the hood because there's some real issues there, and people deserve to know who's doing the best job, where our employees are going to get the best care, and how we can improve that. And I think that's really a fundamental principle for employers, and they absolutely need policy to make that happen. They can't do it on their own. They absolutely need CMS and other policymakers to come in and say, yes, you're going to have transparency, we're going to enforce it. Just to your point, absolute transparency across the digital divide.
If I may, Leah's been leading this effort for decades, and it's been an important voice. If you don't have open underlying data, you can't run the calculations for who's high quality and low quality. So in 2019, we had just the inkling of a bipartisan effort. Senators Lamar Alexander and Patty Murray in the Lower Healthcare Costs Act of 2019 proposed a provision to create a national all-payer claims database that would have allowed us to study quality across the board for commercial and government-sponsored plans. We don't have that in the US. In the Senate Finance Committee, they got a majority of Democrats and Republicans to vote that provision out. And it was a modest investment. I think it was $20 million to sort of seed this thing and through a national nonprofit. We were this close. It did not make it into the final No Surprises Act. So we don't have a mechanism to pool the data on which to study the very thing that Leah has been championing, which has been, you've got to do what you can with the data you have, but it'd be better if we had full transparency. So maybe we bring that back if we're lucky.
Yeah.
But alternatively, if we get more employers to join the CMS health tech ecosystem. The very data that you're describing is now available in this negotiation that President Trump made with the health records companies. Prior to this an agreement, employers could not query for the medical records. First of all, there's a privacy question. Should you, de-identified, how, whatever. But mechanically, that would be releasing data for treatment, for payment. But today, we only release data for treatment. So under the Trump negotiation, the electronic health records company said, well, if the employers share the adjudicated, the paid data that you just said that you give, you may be able to get, for quality purposes, the clinical data so you can measure quality. Well, that's a great trade. And it'd be phenomenal to see, coming out of today's event, more employers aware that they can participate in this give to get voluntary initiative. The invitation is open. Everyone is welcome to that. I mean, look, I'm an Obama guy, and I'm celebrating a Trump thing, right? This is an amazing world. That's what's available to us today to accomplish the mission that we've just heard.
You have a really unique perspective, having a background in both the government and private sector. So where do you see the biggest opportunities for employer-government partnerships on digital health? I mean, you mentioned
infrastructure. If the data flows, as you've noted, I think the employers will do a lot more with it faster, just because they're getting more novel, innovative, collaborative. So, but before, the data's been inaccessible. So number one, if the infrastructure works for the betterment of all, amazing, number one. Number two, I do think we're flipping the moment where Dr. Google moving to Dr. ChatGPT is literally going to change. And that just there's an opportunity, no pun intended, to leapfrog. So employers that distribute, AI-powered navigation may be faster to get people routed to the trusted best next place to visit, faster than it is delivered through a Medicare organization, maybe. So that's like a technical opportunity. And then three, I do think there's like this dream question, what is the definition of quality? What is the definition of what it means to be evidence-based, especially in an era where novel therapies and novel tools are coming to market? We can be a lot more agile in developing new definitions of quality and new mechanisms of measuring and disseminating the results of that information, so that when we bring GLPs to the market, we now have a mechanism to know, well, some are using it in a cost-effective way appropriately, and others are not, and we can distinguish versus having a binary to fund GLP or not. And that's an opportunity that I see in front of us.
Oh, Christophe, you looked like you were going to say something. Well, in that case, I have a question for all of you. You mentioned Dr. Google and ChatGPT. I talked to the lawmakers earlier about how they see AI fitting into this equation. I would love to get your view, Christophe, and then you, Leah, on AI and how it plays a role in data here.
Well, healthcare is about big data, right? So let's dream of a world where we have a very comprehensive data set in an anonymized way for all our employees. And this data set is enriched all the time. And then you have some AI model advising the person about what is the best way to manage their evolving health situation. I think that would be AI powered from an employer point of view. So, and again, it's all about prevention and prediction, instead of just waiting for the treatment, which is very much too late. That will be AI powered. And so it's this ability to digest this data to provide the best advice for the future patients, but before they become patients. I think that's really how it should pan out, instead of just increasing the deductible and the copayment, say, well, okay, do what you can.
Right. And Leah, on AI, I mean, how do you view that?
Well, I think we look at AI particularly within hospitals and health systems. So while we are extremely supportive of efforts around prevention, and I do think the MAHA movement is disruptive in a refreshing way. Certainly controversies, and I won't get into those, but there's lots of, I think, important conversations that are happening as a result of it. Nonetheless, a third of health costs, roughly, are spent inside of hospitals. And too frequently, when we're talking about new innovations, we figure, well, there'll be post-hospital environments. I mean, most people think, we'll make hospitals go away, we'll prevent people from needing them ever. People have babies, they break their legs, they have heart attacks. They will always need hospitals. And we need a strong and vibrant hospital infrastructure that's also more efficient and far safer for patients. So we like to look at some of the innovations in AI that are very promising for improving how patients are treated within hospitals or hospital systems, the broader systems like with physician practices, et cetera, ambulatory surgery centers. There's some extremely exciting innovations like ways that AI can go into medical records, and like Oracle actually I think is starting to work on this as well as Epic, can go into medical records and help physicians and nurses predict when an error or an accident seems likely or something's about to happen from a patient safety point of view, or when there's a medication error, they can grab onto it and alert somebody to it. Things like that can prevent enormous amounts of harm within hospitals that's happening now, so it would have an immediate impact. They can also synthesize through all of the sentinel events that are reported within a hospital and help clinicians make sense of it and begin to understand root causes better so they can address it better. As I said, during the course of a single day, over 500 people will die of a preventable medical error. So this is a huge area where we can have immediate impact. So we're pretty excited about the use of AI, but it has to be a financing system that makes it an incentive for hospitals to truly embark on that journey with their AI systems, and I'm not sure that's happening yet.
All right, Christophe, you mentioned preventative care and predictive care earlier, and I want to zero in on that a little bit. What would it take to make such a shift toward preventative and predictive care? I mean, it's obviously so incredibly important. How do we prioritize that?
Well, I think this is the only way to really reduce the growth rate of healthcare costs. Hospital efficiency, of course, is a big piece as well, but we need to move into predictive. There is prevention and predictive. Prevention is really eating well, exercising, sleep well. I mean, but predictive is about understanding how the healthcare status is progressively evolving towards a potential disease, and acting early enough, but to detect that slippage, if you like, that's trend. And I think we will have this capability very soon because we talked earlier about sensor. I mean, pretty much everyone in the future will have not only a watch or a ring or whatever, but multiple sensors. But we need to collect this data and to analyze this data beside what is already used in the healthcare systems. So we'll be able to detect this trend and act early. And I give you an example. At Takeda, our biggest healthcare cost today is musculoskeletal pain, so back pain, and that's our number one cost. Well, you can predict that actually. Mental health you can predict as well, and so it's all about this prediction. But today we are not able to do that. We are not able to do that because we don't have access to that data, and so we need to clarify what type of data we are allowed to have. And it's anonymized but personalized. So it's if you just analyze your data saying my health status of my 20,000 employees in the US is X, you don't go very far. So you need to have anonymized but personalized data so that you can give personalized advice. I think that's really really important. And then of course, everybody eventually will use healthcare services, whether they are clinics, hospitals, fees, and that's where we go back to the price and the quality. Right? Where is it better to go? And today it's completely opaque, right?
Right. Right. Aneesh, we talked about digital health, AI, et cetera, but how can employers encourage faster adoption of those digital tools?
Well, I mean, let's build off of where Christophe went. I mean, literally, I couldn't be happier with your words, because if people pursued that in the employer community, we'd be in an incredible place if we kind of got the plumbing right, the data right, the privacy policy right. The key factor here is incentives. The power formula is opening up the data plus reforming the payment equals innovation. And so the payment incentive, if I were to sort of make a humble request of my employer friends, hug CMMI. This is the innovation center inside Medicare, which has the authority to test new payment models without having Congress micromanage it. It's the first time, I believe, Congress ceded its power to micromanage physician payment and allowed an executive branch agency to manage it. That one of the many gifts in the ACA was this sort of transfer of authority. So in the MAHA movement, I am very confident there's going to be a MAHA model that CMMI will design to create an economic incentive to treat back pain more in the preventive mindset relative to the maybe the more treatment-oriented. And so that condition-based bundle, where prevention is a key factor, if the employers joined CMMI to do a multi-payer test of a new payment model, when someone is initially diagnosed with back pain, there could be an expected budget. And if you, through wearables and coaching and whatnot, help people stay healthy without the need for surgery, those savings can be divided up between the providers who organized it that way and the employers who were underwriting it to come out ahead. So that type of shared economic model where the incentives are aligned to drive the prevention, that's achievable. And we will 100% confidence see a CMMI MAHA model. I mean, how could we not, right? This is RFK Jr. We haven't read the model, it hasn't come out yet, but they've identified this is a priority. If the employers join in that cause voluntarily, I think we're gonna see a big sea change in exactly the things Christophe described.
You know, I ended on a positive note with the two lawmakers, so I want to ask you all what you're hopeful for in this space. Aneesh, we'll start with you. You kind of alluded to it there, but what are you hopeful?
President Obama said, while Washington sounds massively attacking and negative, we operate within the 40-yard line. If you hear anything out of my voice today on this issue of data in healthcare, AI in healthcare, innovation in healthcare, and payment reform in healthcare, that's in the 40-yard line. So let's work together in the 40-yard line to bring this vision to life. I'm hopeful because we're seeing it. And to me, I see this as a natural extension of work that was started during our time, but call it whatever you want, it's moving in this direction.
Right. Leah?
Well, I'm excited about turbocharging a transparent movement in healthcare. I think by sharing the data with new technology, allowing consumers, individuals, to look at their own medical records on a routine basis, to correct them perhaps on a routine basis, and to have more tools for their own prevention, I think is incredibly exciting. It's going to depend on transparency. That is not easy. There are lots and lots of kind of undercurrents in the healthcare system and other places that want to restrict access to the kinds of data that people need, and that happens all the time. We are continually fending that off. So it's a recognition that we need the transparency and then somebody willing to fight for it. So all of us need to fight for it. We certainly need employers out there fighting for it, but transparency does not come easy in healthcare. And that's what I'm seeing that's most exciting about this new, I think, this new world of better value in healthcare.
And Christophe, finally.
Well, I'm very hopeful because we are facing a burning platform. The reality is that nobody can afford the healthcare growth that we are facing. So it's a good moment to reinvent what is the dynamic and the rule of the game. You mentioned transparency. It's correct. All the different stakeholders are against transparency. That's why it's probably the right thing to do in order to improve the system. And I think we need this transparency, and we need now to have access to this data to become more predictive. And I think we are in a unique moment with the burning platform, with the technology being there, and the willingness of employers to create potentially a competitive advantage vis-à-vis their competition. Because I think that the employer who will design a clever health benefit in the future will have a competitive advantage versus another employer in the same field doing business as usual. I think that would be interesting.
Well, thank you all for such an enlightening discussion. I really appreciate it. I think we'll exit this way. Perfect. Thank you.
That brings us to the end of our program. Thanks to all of our wonderful speakers this morning. On behalf of The Hill and our sponsor Takeda, we'd like to thank everyone who joined us here in person and those of you who tuned in online. If you missed any portion of today's discussion, the full event video is available on thehill.com. Thank you very much and have a great rest of your day.
you.